Good morning, good evening. Welcome everybody to another CustomerGauge webinar. This one entitled Patients, Promoters and Profits. And I'm delighted to welcome on the call today Nancy Becker from Urgent Team. Hi Nancy, how are you doing?
I'm doing great. Thank you, Adam.
Okay, just so for people that don't know what we do on these things, I'm the CEO and founder of CustomerGauge. I've had years of experience in Net Promoter, but one of the things I really love to do is understand from our customers how they use the system, and also how they benefit from Net Promoter. So we love to share on this, and Nancy's very kindly agreed to talk about how Net Promoter and patient experience is used in the urgent care world. Nancy, thank you so much for joining today. Can you tell us a little bit about yourself? Can you introduce yourself?
Well, thank you, Adam. Actually, I've been in healthcare for a little over 25 years. Actually, I've never had a job that wasn't in healthcare, so it really is all I know, and have really had a passion for it for a long time. So I've worked inside healthcare systems and I've worked outside. So currently, working with a company that has urgent care facilities in Tennessee, Mississippi, and Arkansas, and that's just been a great pleasure working in an ambulatory setting.
Listen, while we talk about that, why don't you tell us a little bit about Urgent Team then? Tell us a little about the company.
Well, we have 29 centers currently, and soon opening next week, opening the 30th. And we have several locations that we plan on opening before the year is over. So it's a great time for the urgent care market. We're seeing a lot of growth, so that's very exciting. We are typically in suburban and rural markets. That's kind of our niche area. And our mission is really to provide care to patients in a very convenient, economical, affordable, and we think it's important, a compassionate way.
Now, can I drill a bit into that? I mean, some of the audience we've got, they'll probably be in Europe or maybe in other parts of the US that don't have a clear idea of what an urgent care is. Can you give me a little bit of color about the industry and about the difference between an urgent care and a hospital care?
Certainly. Well, the premise of an urgent care is it's something, well, we like to say when you need more than a Band-Aid, but less than an emergency room. So it's a broad spectrum of care. Typically has X-ray and sometimes on-site labs, those sorts of things, but also is built on the premise of a walk-in care. So this is not an appointment-based business and typically has extended hours, so 7 days a week. Maybe into the evening, maybe early opening according to the particular market. So it's accessible, convenient, walk-in care for injury, for illness, and even for wellness care.
I'm guessing that fits in with people's lifestyle these days, because if they're at work, that means that they can go in, just almost like a retail outlet. Would that be true to say?
Oh, absolutely. In fact, I see it as really kind of the retailization of healthcare. I mean, more and more people are looking for convenience, efficiency, affordable care, and we have to be where they are and at the times that they can access it.
Well, that's great, actually. I've actually flipped back to where I want to go with the talk today. One of the things I'd love to cover in the next 15, 20 minutes or so is to dig into a little bit about some of the best practices that you think is important in patient experience. And I'm interested also from a personal view about how Net Promoter is used. From my side, I actually come from the retail business long ago, but we work with a lot of retailers now, and I'd love to share some of those findings with it. So I think between the two of us, we can be able to see if we can bring the worlds of retail and patient experience together and maybe learn from that. Does that sound okay?
Absolutely. I think healthcare has a lot to learn from the retail space.
Okay. Well, without further ado, let's dig into this. So I'm going to ask you a few tough questions here, Nancy, but what do you think is really patient experience? Why is measuring it important?
Well, I think every business, in order to be successful, really has to understand the expectations of its customer. In our instance, it's the expectation of our patients. So we have to set out to understand that. And certainly the patient experience, a survey tool, conversation, patient engagement is how we go about knowing those expectations. I mean, let's face it, a patient comes to us with a set of expectations. It's up to us to know what those are.
So, we spoke about how patients can often be promoters. But what happens? I mean, if you get a better experience, what is the outcome of that? How does that affect your patients?
If you get a better experience, people have a tendency to, first of all, gain trust, become more loyal, come back to us. So it really is very important. The other thing, as far as clinical care, there's not a direct relationship to improve clinical care, except if you think about the patient who comes and has a great experience. They're more comfortable. There's less stress involved. They have a higher trust level with the provider. That allows them to share more, have a better interaction. There's more listening going on. There's more understanding going on. I think all in all, you end up with better outcomes.
So it's really important to not only to just for your business to make patients come back, but even perhaps for the wellness of the patient.
I think so. We're understanding that, loyalty, trust, care has an emotional component, and the experience really feeds into, how they feel about where they come and where they seek their care.
That's I love the outline that you put on that. So we've gone from the big picture of why it's important. So tell me a little bit about how you do it. I mean, we've got a picture of a typical survey here that you do, but tell me a little bit about how you used to do it and how you're currently working on it.
Well, we're doing a shorter survey than we used to do. We're currently at 3 questions. We used to do a longer survey. But I think you have to decide when you go into it, what is it that you really feel like you need to know? And then narrow the survey to those really key points that you want to find out. And, we've tracked our response rate, and we're doing a slightly longer survey. We had a response rate that was around 15, 16%, and now that we're shorter at 3 questions, it's up around 18, growing a little bit. And so the length of the survey is important, so that's part of what we have looked at. That still gives us enough information for us to act on. I mean, the reason we ask the question, which I think, a survey is really a conversational tool, an engagement tool with the patient. You ask a question, and hopefully they answer.
Yeah.
Then we feel like we have to deal with all of those answers. So for us, every survey is read, every survey is dealt with in some form or fashion, because we're looking for learnings. We're looking for actionable items that we can either improve the care that they're giving, answer a particular question, or just learn in general about what population of patients are looking for in each market.
Now, you base your survey around the Net Promoter System. Why is that? Tell me a little bit about why that's important to the mechanism.
Well, I've used many things over the year, but I think the Net Promoter Score is the one that has been the most studied and truly gives you some real specific information. I mean, it's a fine line between a promoter and a passive.
Yeah.
I will tell you that in one of our recent acquisitions of a company, they were for many years using a yes-no kind of system about will you refer. And when we moved them to a 11-point scale, 0 through 10, the amount of information that we learned from that was great and really allowed us to move the bar. So I really believe the Net Promoter Score makes a difference.
One of the things I also really like about it when we work with clients is that it's quite easy to explain to all levels of the organization what a promoter and a detractor is. I don't know if you find that. People get that idea. It's really a nice thing for them to do.
Very much so. People are sometimes a little intimidated by the scale. When you look at it, there's only 2 points out of 11 that really give you a promoter, but it really is true. If you're looking for people who are going to refer you to friends and family, are going to talk about the organization, really we're delighted by the experience, that's a high number to reach, and it should be what our goal is.
So let's drill into a little bit more just about the mechanics of this. So how are you delivering survey invitations to customers?
We're doing it by email right now, which is what we have always done, even with our previous survey. We have looked at text, but to be honest, right now we're staying with emails so that we can compare this longer survey to the shorter survey, make sure we've increased our response rate. so that if we add a text component, we can have a comparison as to whether it provided an improvement or not. We're thinking about the possibility of our primary survey on email and then our reminder survey going out on text.
Got it.
So I haven't tried it yet, so I'm not. I think there's many ways to do it, and we all have to look at our individual markets and our patients. And we all know everyone are on mobiles right now, so that's an important.
I agree. And what about this thing? So we got this this concept of having a kiosk. I'm never so keen on that because it's quite passive and we know the response rate's low. But what about having people with iPads, or as I like to call them, tablet swingers? Is that a component of something that you've used in the past?
I'm going to use that tablet swingers because we actually.
Let's make it a thing.
Yes, we have a lot of tablets in our centers. So we have our providers and middle staff using tablets to chart and interface with our EMR. We haven't used it for the survey. I believe it's better for the person to get outside of the environment and kind of have the whole experience and then to answer the survey. But some people feel other ways. I think again, you have to look at your individual circumstance. As long as the kiosk still ties you to the individual patient, I don't think it's very helpful to have information if you lose the identifier of the individual who answered the question.
I agree. It's all about tying it back to the data. Listen, there's just the last thing about this. I'm fascinated about it. Is your process automated, and how soon after a consultation or a meeting is your survey sent?
So it is automated, and actually we've become more automated recently. So our previous survey, our reporting was monthly, and so we would send out the surveys, get the results back. We had a few alert systems in place, but basically we would understand, and we look at a monthly NPS. Each center would be able to understand their NPS for the previous month. We've moved to a real-time system now so that we can look at it every day, which I think has really helped because it helps you to further embed it as an operating,
totally agree.
For the entire center. It really is a discipline. So an operating discipline for the center, and they're looking at it on a daily basis, gives you the opportunity to make adjustments, on the fly and for the individual patient without waiting to the end of the month to see what happens. So we've moved from kind of a retrospective review to a prospective review, and I think that's really important.
I'm glad you moved on to that because I'm also fascinated. So now you've got this automated process. What are you doing with the comments and the results? Tell us a little bit about how Urgent Team are doing that.
Well, we read everyone, and for all the demoters, for all the people that are detractors, we make sure that we contact them, each individual, and we do that by phone. And so if we can, sometimes you can't, you may have to respond by email, but we want to talk to each one of them about a bad experience. We also talk to many of our passives and many of our promoters. So you can't underestimate that the time that this takes. It really is time, but we feel it's time that is well spent, and certainly part of the kind of the tools that you need to give the manager in order to improve the center and to manage the center. So if you're going to ask a question, you should listen to the answer, and once you've listened to the answer, you're compelled to do something about it.
So each of the managers in your centers, they get reports and they're actively involved in this?
Absolutely. They actually have access to our dashboard, so at any given moment they can see the next survey that's come in. They can respond to it immediately if they're able to, and they can see that ongoing NPS score, response rate, what's happening. If they feel like their response rate is low, they begin to talk about it in the centers. They can ask patients, hey, it's important to us to hear what you have to say about your visit. Please give us feedback.
That's brilliant. I mean, it really sounds like Urgent Team are really on top of the patient experience in this way. It's really good to hear. Let's move on a little bit so when you get a response, and let's say you get a bad response from a patient, what happens then? I mean, do you act on it? Tell us a little bit about the process that goes on.
Well, we've set a metric that we need to respond to those within 48 hours. Most of our managers do it prior to that, but each individual manager at the center is responsible for their center's follow-up, and we call it closing the loop. I think at CustomerGauge you call it firefighting, which I think is a great terminology. So they call that patient and they find out, what happened during that experience. Is there anything that we can do to make any part of it better now? Maybe some of it is related to something that happened with a prescription or something that they felt like they should have gotten, paperwork.
Yeah.
There are some things that you can fix. So the faster you respond to those complaints, really, those reviews, those responses, then the faster you can do something about it and salvage the relationship.
I agree, because it happens so rarely, doesn't it? I mean, if you get a lot of surveys out there, I know I've filled in as many as I can myself. Very rarely somebody reaches back to me. So again, it's super impressive that you do this.
And you know what? At first, when we started, you get pushback. I mean, it's a clinical environment. Patients are being seen. We worry about wait times, and we're adding something to that environment. But our managers now love doing it. They love the interaction with the patient. They love the problem solving. And then, of course, there are lessons learned that you can use across the organization of things that may need to be changed that are, that will help the patient satisfaction for everyone. And we try to share those things.
I'm going to pick up on your point there, because I really agree. It can be quite confrontational to see feedback at first. So how did you get over that in the organization? How did you educate your team members that
you almost have to jump in to do it, but people who had more experience in doing it and talking to patients and more experience working with somebody to problem solve over the phone, would help. Sometimes we'd look at a problem, we'd look at a response from a survey, and kind of decide what the approach might be, what we might offer to do, how we might offer to help, how we might solve it, so that you have a bit of a plan before you get on the phone. After you jump in and do it a few times, we find that people are so appreciative of the phone call that typically the conversation starts out very well.
Yeah.
And most people really, I don't think I have any manager left that doesn't enjoy making these calls.
Good to hear. Good to hear. Let's move on a little bit. So we've established how you do the survey and how you do the reporting, and also closing the loop. Tell me a little bit about how you and Urgent Team see the benefits of this. What happened? What's been happening with the program that really makes it stick in your organization?
Well, overall, it's helped us to improve, and I mean that obviously that's a good thing. And improvement means higher retention, repeat visits. It helps us with actually with the work environment. Hand in hand, our team member, we call them team members, our employees, our team member experience and the patient experience really goes hand in hand. And if our patients are having a good experience, it's a better environment to work in. It's a happier environment. It's a more rewarding environment. And the same thing, we have to take care of our team members and make sure their experience is good, because whatever's happening with them will flow over, and affect the patient. So I just think it's a good operating discipline. It is delivering on expectations in any relationship, and certainly a provider-patient relationship is an important one. Understanding expectations, meeting those, is just fundamental to everything we do.
I think that's a really great philosophy to have. And what sort of success have you had in relating that to actual, dollars coming back in terms of profitability? Is there any way that you've been able to show that a higher NPS score results in improved retention?
Well, return on investment, ROI, is always difficult to measure. We all struggle with that. One thing that we did is that we looked over a year at our growth trends of all of our centers, on an individual basis. And we compared that against a set of parameters. We probably picked 40 parameters. And it was everything from NPS scores for that center to population growth in the area, all sorts of things. And the metric that had the highest correlation to growth, whether that growth was positive or negative, was the NPS score. So we found that very validating, that NPS can be a leading indicator of growth.
That's a really interesting stat to have, actually. That's it's really good, because I think many managers believe that it's the right thing to do, but to really manage to pull that out, that's really good, really good. Now, if I can, Nancy, I'm going to move on to the retailization. That's not an easy thing to say of urgent care, and I'm going to bring out some of the things from my original background, which was in retail. And so I'm going to put a few hypotheses things here, and you can shoot me down or agree with them on this. But I think that we deal with many retailers, what they call multi-channel retailing, and I think there are some similarities. First of all, there's a lot of walk-in business. Yes. Customer experience is really, really important. You know, it's about the person that you meet, the cleanliness. I mean, there are some other parameters in a retailer that you don't have in a medical environment, but there are some similarities there. They have IT challenges, and there's a lot of competition. So, do you know, compare and contrast that to your world? Is that a good fit?
Oh, absolutely. And even though we certainly want to think about the notion of healthcare as being certainly on a higher level than our retail purchases, but the customer, the patient, has the same kind of interactions with us as they do shopping for clothes. So they have choice. They can go to the urgent care on one corner versus the other corner. So they have choice. They decide what's convenient for them, and that may be middle of the day, that may be early morning, late night. So we have to set our hours based on what we think is convenient for that group of patients in that market. And that's very much like retail. And of course, there's cost. You know, you can't extend your hours around the clock, and costs are very high if you don't have enough people who want those hours. So we're very much like retail in determining, balancing, you know, cost and convenience and efficiency. And people today, they want to come in and they don't want to sit. They want to be seen, and they want to move on with their lives. They have other things to do, and so we have to be very cognizant of that. The experience
I agree. Just like in a store, if they're not getting attention, they have the choice about going somewhere else, which is a contrast to conventional health, I think. So,
absolutely.
The other thing I picked up is, if I think about most of the things I know about retailers, on the online world, they've got a pretty good idea of the customer identity on email because they have a CRM system. But in the real world, in a retail store, you don't often get that identification of a customer, so it's quite anonymous. So in retailers often have to do what they call a till receipt survey, very low penetration, about 1 or 2%. So again, I think you've got systems that identify the patient a lot more. Is that true?
Well, absolutely, because there's payers involved and insurance. We have a lot of detail about the patient. So we can segment our market. We can look at our market and see male, female, age, you know, insurance carrier, all those sorts of things. So we're not wanting in data. It's a matter of what to do with that data and how to use it and what do you learn by it.
I think that's really interesting, especially as we go towards. So I put some things there. What is important to retailers? Again, I'm looking for the sort of compare and contrasting. So retailers have many things that's important to you. They need to report at multiple levels. There's a boss view, as we like to call it, and the store, and also breaking it down to the agent is important. They love metrics, so and especially they want it in real time and broken out just in the ways that you described, Nancy, actually about the segmentation.
We talk about same store growth here. I mean, we talk about each location and its individual growth rates versus, you know, on average across the company. This reporting, NPS, patient experience growth rates are important from the board level at a very summary level, you know, all the way through our organization to the center manager and the staff that want to know, how do people perceive us in the community? I mean, the LPN, the medical assistant that works in the center, wants to be proud of what they're delivering to their community, and by being able to provide them with some of these wonderfully positive comments and feedback of where you really helped someone, really helps the team understand that what they're really there for. I mean, we're really there to deliver care. In our instance, we want to deliver efficient, convenient, you know, affordable, compassionate care. This allows us to see whether we're living out that mission or not.
Yeah, I think I really like that analogy. I'm going to skip over to my last points on this, which is about how what I see in the retail world that may or may not benefit urgent care. So this is my take on it. But the number one thing that I always coach our clients and net promoter people on is to say thanks for responding. It's a simple and very easy move just to say, hey, thanks for your feedback. By the way, this is what we learned from everybody in the last few months. And then moving on from that is what we call activating promoters. Here's an example of one of our retailers that says, hey, you said you would recommend us. Here's some tools to help you do it, which is in the form of a coupon, and then tracking it back. We see social reviews, so using it like TripAdvisor, putting it out there. And then finally, for me, one of the things I love about this is going into the data in a deep dive, the big data approach, by looking at the customer lifecycle value. And that's typically hard for retailers to do, but there are tools around, and CustomerGauge is one of them, that allows you to have a look and see, are they a promoter or a detractor over time? What are they spending? I mean, tools like this in your business, is this the sort of thing that you think urgent cares would use or benefit from?
Absolutely. I mean, I think it is important for us to look at the lifetime value. If a patient continues to come to your center, continues to have their repeat visits there, how important that is. And that's because of loyalty and trust that they've developed over time, instead of them trying, scattering their visits across centers. Now, an urgent care center doesn't see the whole continuum of care. Obviously, there are times patients are in the hospital, need to go to the ER, those sorts of things. But for those urgent care visits, you want them to be loyal to you. And I would believe, and we haven't really finished looking at this yet, but you have to believe that promoters are going to, over time, be of greater value than detractors. Detractors have a tendency to go somewhere else, or maybe come to you if it's convenient for them, but if they have a choice, they're probably going to go in a different direction.
Great answers on that. Now I'm going to lead you on to something we spoke about before, Nancy. I was really taken by these, your 4 pillars of PX, patient experience, and I think you weren't even aware of it at the time that you had a in front of each one of them. So let's talk through this in summary about the 4 pillars of the urgent team's PX.
Well, obviously we're looking at growth as an organization. We want to be successful as an organization. Growth is successful to every business, no matter what kind of business you're in. And there's 4 areas to that. Retention, keeping patients that you have. I call it the leaky bucket. We can spend all kinds of marketing dollars and be visible and get new people in the top, but if they're leaking out the bottom at the same time, you're not really going to see much growth. So retention is really important. Revisits, I guess in retail this might be like cross-selling and those sorts of things, but if somebody shows up the first time just for a flu shot and has a great experience, you want them to come back, when they don't feel well, when they have an injury, they realize that you have x-ray, and maybe they have a sprain, or maybe it's a cut and they can come there and be sutured. So revisits are important, and a good experience allows you to grow that. Referrals. We all know that people who have a delightful experience, an exceptional experience, who are a promoter, go and tell their friends and family. And that's an important concept. Yeah. We all talk about great experiences. We also talk about bad experiences, so those detractors are out there too. But the promoters go and talk about it, and so their family comes, their friends come. And then the 4th one is your reputation. I'm really thinking here of your reputation online. Some of those people will go out and they'll give you a star rating. They'll do a review. Well, now they've gone beyond their typical area of influence, and they've announced and done that referral and that review to the world. And so your online reputation, your reputation in the community is really important. So to me, those are the 4 areas of growth, and all of those are supported by a good patient experience system.
I love it, Nancy. I think you've really summarized that. And if you've not trademarked these 4 reads, you definitely should, because I think it's a real winner. It's a really great mnemonic for growth, and I've been doing this for years. I haven't seen anything quite
Thank you.
Simple as this. So
Yeah,
I wish I'd thought of it myself, actually.
I don't even know if they're original. They've just developed over time. It's what we talk about. We talk about client retention, patient retention, and return visits, and it is what we talk about.
Well, I think you've given a brilliant summary there. Now, we've got just enough time to go through a couple of questions, actually. Would that be okay? So we've got a question from the floor, Mary. So the question is, how quickly do you send a survey out to a patient after they leave a facility?
Well, there's no magic formula for this. What we do is we send it out the next day. So everything up to close will become a file overnight and will go out the next morning. So we are doing the next day follow-up. Now, when we chose that, it was important to us to be learning about the visit itself. We knew that when we did that, we would be losing some information. So what are we losing? We're losing the rest of that journey where they get the bill, or maybe the referral didn't come through appropriately, or maybe there's something on day 2 or 3 that they didn't like. But we decided that that was the place in the patient journey where we could learn the most, and that's why we chose it. Someone may choose somewhere else based on where they think their needs are.
Good answer on that one. Right, I think we've got just time, looking at the time here, just for one more question, which is from Ian from Portsmouth, New Hampshire. Ian says, do you do employee net promoter score? He says, can you do employee NPS so we can track how our employees feel about working in our business? Is that something that you're doing or thinking about doing in urgent team?
We actually do a team member survey, and to be honest, we haven't used, that's a really great question. We haven't used the NPS to do a comparison. It has been more of a traditional survey tool about communication and benefits and compensation and those sorts of things. But having said that I'll be looking into that. Be a great comparison.
Good answer. I think from my point of view, I'm really interested in looking at some benchmarks in the future. That's our personal passion, or our passion in CustomerGauge, is to really look at benchmarks all around that, not just of Net Promoter, but from response rates and how quickly you do that, to try and get some benchmarks across industry. So I'd love to work with you on that in the future and other urgent cares as well. But Nancy,
that's great. Our national. So
from my point of view, I would just want to thank you so much for being with us today. Great content you've got. I love learning about urgent cares and about PX. Thank you so much for your time. I look forward to welcoming you back in a future one. And everybody who attended today, also thank you so much.
Bye. Thank you.
Take care. Bye-bye.